Welcome to Keeping It 100. I am Dr. Kristin Motley, President of Healthcare Solutions of Delaware Valley. I am glad to be back here again this evening for this very important conversation. We know that getting the COVID-19 vaccine is not an easy decision to make. Honestly, it was not an easy decision for me. It was hard for me to decide what to do about my 10-year-old daughter. So it's tough for parents, and we know that. And so that's why we're having these conversations this week. Tonight, we're talking to moms. And in a lot of cases, even in the married couples, have the final say on what is happening with the kids. And so many of you have questions and valid concerns, and we want to have this conversation to address those. This is for you. This is about you. So please be engaged, ask questions, leave comments in the chat. We want to hear from you. Before I introduce the panel, I'd like to let you know that we've partnered with the Black-owned business Bazaar to offer free COVID vaccines and boosters this Saturday from 12 to 2 at the Leak Center. We'll be outside at 7th and Yarnell in Chester, so please come through. Vaccines are available for everyone ages 5 and up. If you know anyone who needs a first dose, a second dose, or booster, we got you. Come through. We're doing a live broadcast from there, and it will be hosted by Chester's own Lamar Todd. So let me introduce the panel. First, we have Dr. Walls. She is a clinical psychologist who specializes in trauma, diversity, equity, and inclusion, leadership development. The woman wrote a children's book. She is amazing. She has worked on several COVID vaccine education campaigns, including a major campaign for the Virginia Department of Health. Daveda Graham is a nurse practitioner. She is the founder and chief medical officer of Nurses United for Change and Equity, a mobile vaccine unit. Daveda has treated patients with COVID in outpatient clinics since this pandemic started. She is phenomenal. And to represent our concerned moms, we have Anita Dickerson Davis. She is a certified nursing assistant at a long-term care facility, and she's currently enrolled in nursing school. Congrats, Nita. And Portia Pender, she is a care coordinator for the maternity department at a local health insurance company. Before I go, I want to let you know that Dr. Justin Foster will be behind the scenes with me, helping to find answers to your questions that panelists may not be able to answer. We want to make sure all your questions and concerns are addressed and you have the information to support what we share this evening. So he's behind the scenes helping me with that. He is a fellow pharmacist, and so you are in good hands. Dr. Walls, are you ready?
You know, I stay ready. So
Stay
yes,
ready. Get ready.
that's what I tell people all the time. If you stay ready, you ain't got to get ready. So ladies, are y'all ready?
Yes.
Well. All right. Well, let's go on and jump into this thing called COVID-19 and the vaccine. And so let's just take a moment and talk about from a personal as well as parental standpoint, what has this time been like for you all? Anita, I'm going to start with you. What has this time been like for you?
From a personal standpoint, it's been real scary and a rough ride, not only for my health, but for the education of my children. Just watching a lot of people die from this virus has been a mental stress on not just a lot of friends and close family. It's just been a struggle, period, this whole pandemic.
Yeah.
And continue to be a struggle.
The ongoing nature of it. I definitely agree. Portia, how about you? What's going through your mind as you're hearing Anita say that? Uh-oh, is she frozen? Daveda, I'm going to jump to you until Portia can come back. What about you? What's it been like for you?
I mean, same as Anita, healthcare worker, pretty much been in the mix of COVID since COVID started. I'm also a mom. I have 5 children. So the strain of, like she said, not only dealing with the virus, working around people that may have passed or seeing the long-term effects of COVID, then like she said, you also have to deal with the kids in school, because my kids are still homeschooled. So they've been homeschooled the entire time. So socialization is dying down, a lot of that. So I definitely have the stressors coming from every angle, and I'm here to educate.
Yeah, yeah. And it's so true because, many of us who are in the field and dealing with it day to day, right? It's a tremendous amount of stress. And so we have to have an understanding of how stress impacts us personally, as well as you mentioned your family members, your friends, your coworkers. How do we manage all of this? And so, Anita, I love some of the feeling words that you use, because one of the first things you said is it's scary. Like, what is this thing? And how do we manage it? How have you been managing the scary feelings for yourself as well as for your children?
To be honest, I wasn't managing them in the beginning. It was rough. Just keeping updated with vital information. The being updated with the facts. Teaching my children that social media is not always correct. What you hear is not always correct, and we hear always the scary stuff. We never hear or we rarely hear the positive things out of this whole pandemic. All you hear is just the scary, the things that are not good. And that's it. I can't say that I'm still a little stressed about it. I haven't really. I don't think I have. I'm still on edge about the whole pandemic.
Yeah, I thank you for keeping, this is keep it 100. I thank you for keeping it 100
Yes.
Because, right, the stress isn't over. And Daveda, you kind of mentioned, right, it's this ongoing, we can call it chronic stress. We can call it unending stress, because there's also the stress of the ambiguity, right? We don't know what's going to happen. So many things. If we go back to the beginning, I always remember March 13th, 2020. It was Friday the 13th when we got all of this information that basically the world was in the process of shutting down. And then come Monday, March 16th, then we started hearing this was closing, this was closing, this was closing. And it wasn't even a day-to-day thing. It was a moment-to-moment thing. It was breaking news, do this, don't do that. It's going to last this amount of time. No, it's going to last a little bit further. And it was like, who do you trust? What do you trust? And I know for people of color, then that became a really big question when it comes to this whole vaccine thing. Daveda, what's going through your mind as you're hearing us talk about this?
I mean, this is twofold, because I come with the professional standpoint, but then I also come to it as an African American. So, when everything came out, it was scary. Definitely saw people pass. It was like, wait, what's going on? Being inside was definitely something different. You had to deal with kids that were used to playing, that you had to explain that to, that, why they had to be in the house. And then when the vaccine came, I'm not going to say that I was 100% ready to be the first in line to really go get it. I'm going to be honest. I think the knowledge of things like Tuskegee Project, Roberta Lax, things like that, I feel like that knowledge put me in a place where it was able to get me over that hump. Knowing, the medical standpoint, knowing how viruses work, knowing, the process of formulating vaccines, that helped me get over the hump, because we do as a race have trauma, right? Not only to healthcare, but sometimes police officers, the law system, all kinds of things. So I had to really, sit and watch. And I think my turning point was really in the beginning of December, when I saw so many people a day dying. And for me, being a nurse, we come to things a lot of times with a lot of empathy and compassion. And I used to be an ICU nurse before being a nurse practitioner. So I saw a lot of death. You know, it's one thing to hear about it on TV. It's one thing for a family member to talk about it. But when you know what that looks like, when you know what that pain is, and it's something that, you know, we can all come together and try to mitigate. You know, that was the turning point for me to say, if I'm not going to do nothing else, I'm gonna get vaccinated, because I don't want to see somebody else lose somebody else. So.
Anita, I see you shaking your head. What do you want to say?
So I wanted to say also, I wasn't a fan of just jumping to go get the vaccination. I was forced because I'm in school and it's time to go around clinical. So it was like, you had to get the vaccine, or that was it. That was the end of all my hard work. So I had to make a decision, and I said, you know what? This is my passion. This is what I really want to do. I got the vaccination. I did consult my physician because I do have reactive lung disease. She suggested that, you know, I get vaccinated. She wanted me to wait until, you know, the winter was over, all the colds and the, you know, the flu season was over, but I didn't have that type of time. You know, clinical was starting. I didn't want to be on the computer. I wanted to be out there. So I did it. And I can say that I'm glad I did it when I did it. I experienced firsthand within my household the difference between my children being sick with COVID versus my granddaughter having COVID, being unvaccinated with COVID, and my granddaughter being vaccinated and having COVID.
What did you notice?
Well, my two sons contracted COVID from me. My 11-year-old, he was sick. He was down more. He had more downtime. He had his fevers lasted longer. He was just sick longer versus my granddaughter, who contracted COVID, vaccinated. She may had a fever one day, was fine the next day, a scratchy throat with a fever, and she acted normal. Like she was. So I got firsthand see, and also with my personal self, I was out because of my lung disorder. I had to stay out of work when COVID hit. So I didn't go back to work until my facility was COVID free. Wow. But I contracted COVID again from a worker who had COVID. But you know, I did my time. I went back, and as this new strain came out, you know, COVID arose in the facility again. And so I figure I'm vaccinated. I'm gonna hang in there this time. So now I have patients with COVID, active COVID, and I've spent hours in a room with 3 active COVID patients, and I felt like, you know, I was a little stressed, and you know the outcome, but I don't. So they say you can not have symptoms and have COVID. I haven't had any symptoms. We get tested twice a week at my facility. I have not became positive yet with the second round.
Okay.
So I think that I can strongly say I can see the effects of being not having a vaccine versus being vaccinated.
And I know, you know, getting the vaccine has caused a lot of turmoil within people, right? Making that personal decision. Again, as Black people, as people of color, knowing the history of experimentation, knowing the lack of respect and love and care sometimes within various systems, including the medical system. I know a lot of people have said, why are they giving this to us for free when they've hurt us so much in the past? There's big questions around trust of the medical system, trust of the vaccine, trust of medication, right? Unsure of how it's going to impact each of us because every body is different. I know there's been questions, you know, why do you need 2 doses versus just 1 dose, and how long has it been, right? There's all of these questions that people have. And not only is this happening within each individual person, it's also because, excuse me, let me say that again. Because it's happening with each individual person and they have their own thoughts and feelings about it, then sometimes there's conflict within the family
Yes.
and whether or not they, so I can speak for myself. I ought to was like, well, I'm gonna wait and see because I want to see is somebody gonna grow another head, lose an
You're right.
arm, right? Like what is going to actually happen here? And I went through that whole trauma piece of the Tuskegee experiment. And, as far as psychological experiments that have happened and all types of stuff. And I was just like, okay, I recognize I had to work through all of that before finally making a decision. And like you, Anita, I consulted people who I knew were in the field in addition to doing my own research, right? And using viable sources as opposed to just scrolling through social media and plucking things, but confirming. And so when I went with that, then it was more of a, okay, why should I do this for myself and or why shouldn't I do it? And I take care of an elderly parent and I'm going, okay, I need to safeguard her and I need to safeguard myself. What choices do I need to make that are going to make me feel as though I've done my due diligence as a daughter, as a human being, and so forth? And then I had to sit with the reality that my husband wasn't interested in getting the vaccine because he was saying he didn't trust the quickness at which he felt as though it came to pass. So then it was like, how do we navigate this reality? And Davida, I see you shaking your head a little bit. Is there anything you want to say to any of this?
I mean, no, I think that, like you said, I did a lot of research. My parents are older, so my immediate family, everybody is vaccinated. But I have younger family members that are hesitant, and like you said, they have to work through it. You have to provide information. Sometimes I give them, my standpoint of what I've been through and what I see. But it's just like you said, you have to work through it because it is a sense of trauma with that. It is a sense of mistrust. And that's one of the things that I'm really big on in healthcare, besides talking about COVID, is really trying to get the African American community to trust healthcare more, for more diversity in healthcare to help bridge those gaps. Having these conversations so people can hear people that look like them that trust in the vaccine. So creating that trust and building that trust back, that takes time, but these are things that we trying to work through, and hopefully people hearing experiences, hearing the info, it can help them get to a better place of understanding, but at their pace, like you said.
Right. And Davida, I'm so glad that you said that because, right, trust does take time. And oftentimes we don't think about how trust is developed. So there are some people who they give trust 100%. And with each infraction, it's like a debit, right? That trust is taken away. And then there's other people where trust is not given at all. And with each incident, trust is earned. So it's like money is put in the account. And so when it comes to situations like this, we have to start look at what's activated in us. Trust is huge when it comes to this. And where are all the places where we need to experience trust, or where are all the places where we're not trusting things? One of the things that was highlighted when I spoke with a lot of medical doctors was they realized that they did not have the personal relationships with their clients like they thought they did, because had they had that rapport, you would have had more people reaching out to them saying, what is this about? Give me more information. They would have had a trusting relationship, but they realized a lot of them didn't have the trusting relationship there. And they hadn't looked at why people weren't trusting the medical system. And so, and the fact that there is a pacing, right? Everybody has to move at their own pace and comfort level. The other thing was the vaccine became very political and people started to jump on sides. And that made it very hard for people to actually get information and process it in their own time. Anita, I saw you shaking your head a little bit to some of the stuff that I was saying. What's going through your mind?
Just basically how it became political. I can hear people say, talk about, the president this and this president that, I don't get too much involved in that. I just, I try to make a decision based off of what's best for me and my family. I don't. I listen. I do pay attention, but
you got to come back. You got to come back to self and make whatever that right.
That's it.
And that's it, right? And that's part of what people, that's also another thing that I heard a lot of people saying was they felt like people were trying to, and people meaning the government, the system, right, was trying to make them do something and take away their free will. And that got in the way. Go ahead, Daveda. I see you. What just happened when I said that?
So, I also have a master's degree in public health, and I just feel like people get personal health and public health confused. And this is when I say that it's a whole lot of work that we need in healthcare literacy as well. Maneuvering the healthcare system, understanding the healthcare system. So, yes, in personal health, you have your choices, right? That's why we have Roe versus Wade. That's why we try, people try to uphold that. That's because that's a personal choice. That's a woman's choice to do what she needs to do. But public health is sort of not like that. It's more looking at communities. It's more looking at areas. And so, we have to get people to understand that when we talking about personal disease processes, it doesn't relate to the disease process that can affect us all. Like if we don't, take precautions, we're spreading, people are, so in that sense, it's hard for me to look at it as a personal healthcare issue because I understand that public health affects us all and that we have to be looking out for community when we're dealing with public health and not individual self. Like you had stated earlier, Dr. Walls, that, an elderly family member, or we want to get vaccinated because we don't want to bring it, for me, it was being out every day with a high COVID footprint with patients. I didn't want to bring it home. I had an unvaccinated 8-year-old for a long time. So, it's just like you think about others more when it comes to public health. And I think that concept is lost. So that's why I cringed a little bit.
Yeah. But it's real. Thank you so much for taking that time to really educate us on that difference between that public health and personal health. And again, when we have situations like this, meaning like COVID, like the vaccine, we have to start to break it down and look at all of the intricate pieces that make up this entity. This is why it's so heavy, because it's so many parts. It's also the interconnected nature of it. We're all connected to each other. So you're absolutely right. This is about community. This is about consideration. I saw one time somebody had put on Facebook and they said, I'm not into wearing masks, but if I want to go into a store and they require me to wear a mask, I'm going to wear a mask. Like, I don't believe all the hype, but I respect this person's space and their belief system, and I'll honor that. And so I said, okay, there's community consideration, right? And so we start to look at how do my actions impact the community? What do I need to do in order to make sure I'm safeguarding for self as well as for others? And I'm thinking, as parents, you both mentioned having children. What's that been like for them to have to wear the mask? Because I know that's been a big concern, and especially in schools. And what's that been like for them?
So I have a son who wears glasses. So kind of rough with the fog, breathing, trying to figure out how to make it work best so it doesn't happen. Not just jumping out the car, going in the store. It's like plenty of times, we're ready to go in the store and it's like, oh, I got to go back and get my mask, or we're going somewhere. I have my mask. It's like, do y'all have a mask? Oh, we forgot it. It's like, oh, kid, can't go in the store. It's annoying having to wear a mask,
Yeah.
I've gained a COVID scar from wearing the mask, where the mask must have rubbed right here. And now I have discoloration right here on my lip from wearing the mask.
Yeah. That's definitely. Daveda, how about you? How have your children been with the whole mask piece?
So they're pretty good, because to be honest with you, my school district out here in Delaware County, Upper Darby School District, still gave the option of still staying virtual. And I actually chose that. But I'm going to tell you, I chose it at the last minute. Like, I barely made it in, because my full intent was to send them back to school. Like, I wanted them to go back. But then that's what happened. Like you said, the whole politicizing of everything really occurred during them going back to school, and then people not wanting to wear masks, or, not, the teachers didn't have to be vaccinated. So it was a lot that I had to deal with. And I just decided, then I had kids in every school. Like, I had elementary, middle school, high school. And my thing was, is everybody going to wear the mask? Like, at that age, are they going to keep it up? Probably not. And so I had to make the harsh decision, and was fortunate enough to be able to do so, because everybody can't, to say that they were going to continue to homeschool. But in the same token, Dr. Walls, then you have the emotional aspect of keeping them
about it.
Yeah. Okay.
Yeah. So, talk about it. What is some of the emotional aspects?
When we say we torn, it's like literally.
Yeah. And that stressful part. And Daveda, I know you know about this. As far as when you're stressed, right? It causes that fight, flight, or freeze part to kick in. And when that fight, flight, or freeze kicks in, that means that analytical, critical thinking and decision making gets turned down, or they call it being offline, so to speak. And so as your stress level increases, your ability to decrease the stress actually decreases. And so with children, we're already in the process of teaching them how to incorporate coping skills into their life. It becomes a challenge when we're stressed all the way out as well. And we're trying to figure out this new life world landscape just like they are. We don't have any experience in a health pandemic. So we're learning it in real time, just like they're learning it. And it has been stressful. It's been a challenge. I'm looking at your words. It's been scary. You two have talked about actually knowing people who have died from this virus. So now there's loss that people have to go through. There's bereavement that people need to go through. And we all know that a lot of times people have not fully finished grieving one loss before another one happens. And so it's compounded. It just becomes very heavy and overweight. Daveda, you want to speak to that a little bit?
Well, I'm glad that you are having these conversations, because I just feel that mental health and physical health are so entwined. I am a primary care nurse practitioner, but I'm actually back in school to be able to be a psychiatric mental health nurse practitioner, because it's almost like when you're dealing with the population of people that I deal with, you're providing a primary care, but they get comfortable with you. So it's almost like you start doing the mental health as well. So I want to make sure that, again, the representation is there and that people understand that talking to somebody, getting help from, with somebody. I know so many nurse practitioners, we all got a therapist, you know what I mean? Because and if we didn't have one before, we got one now because so much is going on. And I just feel like these conversations are necessary to let people know that you're not the only one going through these things. Is, unfortunately, we all in the situation, but those coping mechanisms. Ooh, I love that word, because in school, they always talking to us about medicine and this, that, and the third. But being African American, I know we have deep rooted generational trauma. And I look at, well, how did I become successful? But then I got somebody in my family that we raised the same way and they didn't. And it's those coping mechanisms. Somebody gave me coping mechanisms, or I was able to find them and deal with them myself. And I just feel like that when you said that, that is what I feel like we need to focus on, learning how to cope and get through things and figure things out, research, listening to other people talk is priority.
Yeah. It definitely becomes cathartic to talk about it. It's a release. Just even, and this is why I appreciated Anita opening us up with actually identifying feelings. A lot of times people are like, I feel some type of way. And as a clinician, I'm going, okay, what type of way is that? Like, I need you to specifically say that you're scared, that you're nervous, that you're upset, that you're disappointed, that you're uncertain, that you're bewildered, whatever it is. I need you to state those things, because if not, Daveda, to your point, the body-mind connection is so strong that those feelings stay housed inside of your body. And so we talk about triggers, right? So again, going back to the vaccine was a trigger for Black people because it made us think about all the ways in which we were used as experiments and we were lied to about things. And so it triggered us to, it triggered the distrust. It triggered the uncertainty. It triggered fear. It triggered all of these things. And for people who were not a part of our community, they could not understand that because they hadn't looked at the links that occurred over 400 plus years of being treated unfairly, unjustly, and so forth. And so now all of a sudden, these conversations, because now let's also be real, in the midst of the health pandemic came what they refer to as the social injustice pandemic, right? The racial pandemic. Now, as I talk to people all the time, Black people know that we've been dealing with this for over 400 years. So this is not new, the injustice that's been happening specifically to our Black men, but to the Black community overall. But this was also happening during the pandemic, which added to fear. So now we got fear of health and we have fear of loved ones. The increase in violence that has taken place in a lot of cities, here in Philadelphia specifically, it has been outrageous over the past couple of years. And so then we talk about children and isolation, let alone us adults in isolation. They're unable to do the activities. We're unable to do the activities that used to help be stress relievers. Now, the reality is, were we actually dealing with the things that were causing us stress, or were we avoiding the things that were causing us stress? Were we dealing with the traumas that have been passed down through the generations, or were we just kind of pushing them to the side? And so when the crisis hit, known as the pandemic, everything, it was like combustion, as they would say, a perfect storm. Anita, what's going through your mind as you're hearing me say these different things?
I can say that. So I deal in the moment. I didn't think, the only time I thought about, the past, like, I know there was probably a time when my parents were born that I'm not quite sure about this, but I felt like, did they have an option to be vaccinated? Because when they were born, they were instantly vaccinated. But something that our kids get series of, they just got one in their arm. And well, to answer your question, I was in the moment, like, Daveda said, and I think you mentioned, it was, since that day we were living day to day. We were getting, it was something every day. So I was just taking the day by day and living in the moment. What do we need to do now? What's next? I really haven't had time to focus in the in the past.
In the past. Yeah. And
well, when I do think about the past, I thought about, when I think about vaccination, did they have, when they were in their time, it wasn't even an option then.
Yeah, I'm so glad that you said that, because, right, that's the other argument that has come up with a lot of this particular vaccine, is that I know in order for children to go into schools, there's certain vaccines that they have to have. There's certain immunizations that have to have taken place. And so a lot of people have jumped on that side and said, well, what's the difference of one more? And then you have those people who say, well, we have the option to take the flu vaccine, or we have the flu shot or the pneumonia shot, so why should this one be any different? Daveda, in your role, what have people been saying about that as they compare this COVID vaccine to the flu, to pneumonia shots?
I mean, people say that, but that's when I get into talking about transmissibility, and the fact that this virus can mutate. It mutates a lot. So, the flu may mutate every year, but the numbers aren't as big as globally as it is here.
Right.
So I try to get them to understand that, yeah, I mean, unless you're in a certain profession where they think you may be more communicable or more at risk of getting that, it's probably not going to show the numbers like COVID. But COVID is highly transmissible. And then the other thing about that is that as long as it continues to jump and jump and jump, the virus changes. And I think that's another thing, is that, people don't, the information is not given to people in a way that they can really understand it. And sometimes they may not have a means to read a medical journal, or, Google on PubMed and see something that's going on. So you have to try to explain it to them to get them to understand. And I think that's what CDC and a lot of places don't really do, so that our community can get it. And they need to know that as long as it jumps, it has the potential to keep changing.
Yes.
And because we're still learning this vaccine, we don't know what it could change to. Like, Omicron was highly transmissible, but not really deadly. Do we get one that's highly transmissible and deadly? So, it's like, these are the things that people need to be told, and they need to hear, because they may not receive that information anywhere else.
Yeah. And Daveda, I'm so glad that you said that, right? Because we were all learning, we meaning the medical doctors, the researchers, we, the lay people just in the world waiting to hear information. We were all learning it at the same time. So as the virus changed and mutated, they had to go along with it. So this is why information was constantly changing, because they were getting out the information just as fast as they were learning what they were learning. Now, what happened with that? It caused people to not trust, because we know consistency, predictability, those types of things help to build trust. So now it's like, well, 5 minutes ago on ABC, you said this, and now it's 10 minutes later, and on NBC, you saying this. Like, who do I trust, and how do I know what to follow and what actually to do? And to your point, Daveda, number one, people weren't taking the time to speak to a whole bunch of people in a whole bunch of different ways. As a teacher, we would call that differentiation. As a parent, you know, what you say to one child, you may have to say it a different way to another one, right? In order for them to get it. We all learn differently and understand things differently. And so things have to be explained to people in different ways so that they get it. Now, I know that one of the announcements I want to make for people who have come to the point where they're saying, you know what, I do actually want to get this vaccine. And I know some people, it's their work that is quote unquote forcing them to get the vaccine. And there's always feelings about being forced to do something. Human nature causes us to have a resistance to it. So I encourage people to, if they're feeling resistance, to clarify what they're actually resisting. Because sometimes we may be resisting something that's actually good for us, but we have to take the time to increase our self-awareness. If you're interested in getting the vaccine, please know that there is an actual vaccine and booster clinic going on this weekend. So if you've already gotten your vaccine and you need to get a booster, or if you haven't gotten any at all and you said, okay, now I'm ready to get that Pfizer or Moderna, and you have a child, because this is for people who are 5 years old and up. Make sure you bring your vaccination card, number one. Number two, it's going to be held this Saturday, February 26th from 12 to 2 p.m. at the Leak Center, and that's Leake, at the Leak Center at 701 Yarnell Street in Chester, PA. You can call Dr. Motley or you can text her at 267-322-0470. Again, right there in the center of the flyer. You can call Dr. Motley or text her at 267-322-0470. And this Saturday from 12 to 2 at the Leak Center on 701 Yarnell Street in Chester, you can go get your dose of Pfizer and Moderna. Remember, Pfizer and Moderna are 2 shots. So you get the first shot, and then you usually have to wait about 4 weeks, and then you get your second shot. And then if you need to get a booster, then that's just 1 shot. Daveda, as far as vaccines, what did you were you able to choose which vaccine you received, whether it was Pfizer or Moderna or J&J?
No, because I was a healthcare provider, so I was trying to jump at the first one I got, and I actually went to Dr. Stanford and the Black doctors, and they were giving Moderna, so I went with that one.
Okay.
But my household is vaccinated with everything. So I have a college student that had J&J. I have a preteen and a teenager, and Moderna is only 18 and older, so they have Pfizer. The adult version, and then I have an 8-year-old who has Pfizer kids. So I'm betting them. I'm betting on them all.
All right, and Anita, how about you? Were you able to choose which one? And then I'm gonna roll back around, and we're gonna talk about side effects, because I know some people are worried about that. Go ahead, Anita.
My husband was the first one to get vaccinated. He has Moderna. And the children and I all have Pfizer.
Okay. And what were side effects like for your husband and Moderna? And here's the reality, right? Everybody's side effects are going to be different. Some people may have low to no, and then everything in between to the great extreme. So this is your husband's experience with side effects. What did he have? And then you and the children, what did you all experience?
So my husband's first vaccination, he was down. He had fever for about 3 days. He was down pretty bad. He didn't feel good at all. His second shot, he was fine.
Okay.
My first dose, sore arm, really, really tired. I think I was tired for like 2 days. I was really, really tired. But that's it. I didn't get any other side effect. The children, I can say they must have been tired, because after they were vaccinated, it was real quiet around here. So I think they had the tired effect also. But but their second vaccination, they were fine.
Okay. All right. Daveda, how about you? How'd it go in your household?
So pretty much the same. I think my husband had the headache and the joint pain with the first dose. He had Moderna also. I just had the sore arm. I mean, it was pretty bad. I know how tetanus is, but it was worse than that for me. Like, it was tender to the touch, but a little bit of heat, and it went away right after. The booster, we both did fine. The second dose, we both did fine with. I'm not gonna lie, my husband hasn't got boosted yet, but I have. The booster took me under a little bit more than the first two. So I had the joint pain, I had the headache, I had to rest that whole day. Thank God I was off. But I want to say probably like in a 36-hour period, it like all of a sudden I was back to myself. The children, they didn't have any issues, maybe the sore arm. And I'm gonna say, like, because I also do vaccine clinics sometimes and even partner with Dr. Motley at times, the children do not, they don't have a reaction like the adults do. When I first started and I was only doing adults, they had more of a reaction. The children bounce back pretty quickly. This is why we give them their immunizations all bombarded at once when they're young, because they can withstand that a lot better. Just what I've seen.
Yeah. Thank you so much for sharing that. So yeah, so we also are a hodgepodge. So I had told you that my husband initially was resistant to getting it. Well, he ended up getting vaccinated, and he ended up getting the J&J. So he was a one and done. And so he got that before there was the recall and all of that whole controversy around J&J. My mother also received the J&J because my biggest concern with her was she has difficulty with mobility. And I was like, how am I going to get her out twice to get a shot? And so I was very thankful that J&J was a one and done. I actually got the Pfizer, and one of my brothers received Moderna. Now, my brother and Moderna were like oil and water. His side effects lasted a very long time, and just about every side effect that you could have, he was checking it off. He had it. I mean, he went through it, and he's a very big guy, and it was terrible, but he was happy that he did it. His wife works in a hospital, and so she received hers. Her side effects were not as bad as his. I received the Pfizer, very similar to what y'all said. It felt like somebody gave me a knuckle sandwich. I don't know if y'all remember knuckle sandwiches where they used to dig your knuckle into your arm. It felt like that for maybe like 6 to 10 hours. It was just that pain that was just there, and it was difficulty lifting it. And I felt maybe a little tired, not quite myself. So what I did was, because I knew that was a side effect, I made sure that I went to bed earlier than usual. I made sure that I didn't push myself as hard. But that, like I said, that only lasted maybe 6 to 10 hours. And then I was back up and feeling the same way. Second shot, I would say it was the same thing, lasted a little bit longer. Pfizer all the way through. Interestingly, when I did the booster actually kind of hit me hard. And I was shocked because I just figured I was going to be all right like I was before. And instead, I was unable to say it's going to be all right. I was laid out for a little while. And probably for about, I can tell you, I got it done at about 5:15 p.m. By between 10:15 and 11:15 p.m., my arm started to hurt. And it wasn't just the knuckle sandwich this time. It was like my total armpit was hurting. And then by 5:15 a.m., I started to have the chills like nobody's business. And that lasted for 2 hours. Y'all see, I was documenting all of this, right? And then that lasted for 2 hours. And then by 7:15, between 7:15 and 7:30, I felt okay. I felt better. I wasn't 100%. And then by 9, 10 o'clock in the morning, I was back. So the booster really did something that, I can't medically explain what it did. But like I said, by midday that next day, I was fine. Now, I share all of that with you all because I want you to know that you may experience some side effects, but they do pass. And I know that I have some friends who have taken J&J and they've received surveys to give feedback. So it's important that if you have the opportunity to give feedback, give it, because they need to know where and how to improve. All right, is Portia back for real? For real?
Yes, technology. I'm sorry
Hey.
about that.
It's all right. Please chime in. I know we've talked about a lot and you've been listening probably behind the scenes. Is there anything that you would like to share?
Well, I haven't been able to kind of hear it because I don't know,
Okay.
for some reason my service is acting crazy.
It's-
I had to turn my router off.
Oh, goodness. It's all right. You're with us now. So tell us just, we were talking about what it's been like dealing, obviously, with this whole COVID pandemic over the past 2, now going on to year 3, but also thoughts and feelings around the vaccine for self, children, family members.
Myself, I fully vaccinated. I didn't get the booster yet. My son, 6. I'm kind of on the fence because he's autistic and actually
We're losing you, Portia. That doggone router and internet service.
Can you hear me?
Yeah, now we can hear you.
Am I back?
I heard you say, yeah, you're better.
Okay. So I was kind of hesitant because my son is on the spectrum for autism. So I wanted to wait to speak with his doctor. And then when I was like, okay, you can get it, he ended up catching COVID. Which I was kind of shocked, and I'm kind of happy that it wasn't too bad because he does have asthma. So that's why I was really nervous about him like catching it. So when then they came out with them having I think it was like heart problems with the kids. So I'm still like, well, you had it already, so we're just gonna wait it out.
Yeah, I think that's. Oh, go ahead, Anita.
So to add to Portia, at that in the moment when the kids were allowed,
I actually wanted to jump in.
Go ahead, Anita.
So my oldest son, my 17-year-old, I asked him, did he want to be vaccinated? He said yes. So kind of like waited around when they all. So I asked my children first because it was brand new. And all in all, they were it wasn't going to be an option, but I made an option. They're up on current events. They know what's going on. We didn't have to be the first thing smoking. So my 17-year-old said he wanted to get it. Then we kind of waited until like the other children, it was time for them. He came to me and said, oh, Mom, I changed my mind because I saw on the news that it's a kid my age having heart issues after he was vaccinated. And I said, okay, son. I said, look into it some more because, people have underlying issues. There's adverse effects. There's contraindications when taking different types of medication. So you maybe want to look into it more. But it's okay. You don't have to now. But the 11-year-olds, my 11-year-old grandson, my grandson and my daughter are both 11. My granddaughter and my son are both 11. I'm sorry. They were ready to go. When we was going out the door, he was right behind us. So you know, like I said, again, there's social media, there's the news, and it was quite, you know, I sat back and had to like look into it, you know, what are these vaccinations are doing to the children. Then I had to, I have the 11-year-olds have asthma. We don't want to catch the baby was like, I didn't want to catch COVID again. I don't want to be that sick again. That's what my 7-year-old was like. I don't want to be that sick again. And then being separated, all of us, like I couldn't be with them while they were sick. We all separated. You know, all kids want their mom when they're sick. Being separated in different rooms, being sick was really hard. So, you know, they went out there, you know, I supported them, and it was done. It's still scary situation, you know, with all that's being said and, you know, everything that's going on, it still was. And then I had to step back and think about, I get my children vaccinated on time since birth. Is this any different? The doctor said they should be vaccinated. I vaccinate. I'm not one of those parents. There are parents out there that choose not to vaccinate their children. I'm one of them parents that my children are vaccinated. So I did give them the option. They chose yes, and I supported them.
Yeah, thank you. Go ahead, Daveda. You're on mute. There you go.
There you go. I was actually trying to respond to Portia because when you're a vaccine provider, you get on these phone calls when they're giving you updates about vaccines and things that are going on. Because like you said, Dr. Walls, it's really ongoing. They're learning as they go. So the heart condition they talking about is myocarditis, and it is happening to some people. Facts. Does the risk outweigh the benefit? Probably not. But the one thing I will say that they are doing about these vaccines are being overly cautious, that if they feel like something may not be correct, like how they pulled J&J, you know what I mean? So one of the things that they have been studying was to reduce myocarditis and to actually increase like your antibodies and a better response to the vaccine. They're looking at extending the date in between the first dose and the second dose. So like, you know, that's right now, Moderna is 4 weeks, Pfizer is 3. The studies are looking at putting an 8-week period in between that, because what they've been finding is that the myocarditis rates have went down, as well as the efficacy of the vaccine, or how well the vaccine works, is extended. So that was just today. So I just wanted to share that so she can look that up and research that. But when she said that, I was like, oh, let me tell her. So I wanted her to know.
Good. And she's listening to you, Daveda. She sent a message that she is backstage, and she does say thank you for that information. And so for anybody else who's listening, Daveda, would you repeat that? What do they need to look up so that they can be informed?
I mean, I was on the CDC COCA call. So the CDC probably puts out reports on their website under COVID-19, and then they have hyperlinks where you can go and you can research and look at the information. But yeah, they just told us in the it's a community outreach call. And so they were relaying that information on the study that was recently done, where they're looking at extending that. They're also looking at giving like how they want to give the immunocompromised, their dosing is getting ready to change as well.
Okay. Thank you, Daveda, Anita, Portia. Thank you. I know you've been having difficulty getting on, but thank you for continuing to try. And I think, right, that's the effort and the diligence and the determination that we're talking about. We're getting information on this whole COVID situation and the COVID vaccine. Get information, do your research, utilize credible resources so that you can make an informed decision for yourself. This is a personal choice. We all hope that you, of course, choose health, whatever that means for you. get the information that you need. Again, this Saturday, if you are interested in the vaccine and or the booster for yourself or for your loved ones, know that there is a vaccine and booster clinic from 12 to 2 on this Saturday, February 26th at the Leak Center, 701 Yarnell Street in Chester, Pennsylvania. Again, a vaccine and booster clinic this Saturday. Pfizer and Moderna. This is for individuals who are ages 5 and up. If you need your second dose or a booster, make sure you bring your vaccine card so that they can see it. If you want additional information, you can call or text Dr. Motley at 267-322-0470. Again, you can call or text Dr. Motley for more information at 267-322-0470. Ladies, thank you so much for your time, for sharing this information. Thank you all for joining us. And we hope it's been helpful, and continue to have the conversations. The more information you have, the better decisions that you can make. And know that we all deserve to be healthy. Take care and good night.